Tobacco use is the world's leading cause of preventable death. And when so many lives are at stake, there's no excuse for inaction. Over the past dozen years, our work has helped save 35 million lives, but there's still much more to do. Tobacco companies seem to find new ways to push their products every day. So I want to thank the WHO for leading the fight against tobacco worldwide. I'm optimistic that we can make even more dramatic progress in the years ahead and help save tens of millions more lives.
Thank you to Michael Bloomberg for kicking off part 2 of our special World No Tobacco Day webinar series, which focuses on tobacco control. We're joined by several health experts from around the world who will help us to understand what are the things that protect populations from the harms of tobacco use, and just as importantly, how do we deter people from picking up tobacco in the first place? For part 2 of our special webinar series, we're joined by public health experts Steve Hamill, Dr. Jane Rahedi Ongongo, and Dr. Hebe Gouda. And they're going to help us understand what role policy and advocacy play in reducing the global burden of disease caused by tobacco. So for our first question, Steve Hamill, if everyone knows that tobacco is so harmful to our health, why is there still so much work to do?
Well, it's incredible. More than 50 years after the U.S. Surgeon General's report in 1964 first linked tobacco use to cancer, 20% of smokers still don't recognize that risk. And when you look at the other risks connected with long-term tobacco use, there's even less knowledge. So awareness really isn't enough. We think governments need to take action now, using mass media campaigns, using graphic health warnings to ensure that smokers and non-smokers know about the harms, not just the lung health harms, but the long-term other harms of smoking and of tobacco use, and that they put quitting and policy action on today's agenda.
Really good point. Thank you for that. Dr. Hebe Gouda, can you tell us what is the World Health Organization doing to push countries to take more action?
WHO has been working to curb tobacco use since the 1970s. And a real game changer came in 2003 when the WHO member states negotiated a treaty known as the Framework Convention on Tobacco Control. Since 2008, we've been monitoring demand reduction policies in countries to see how countries are doing in implementing these policies. So all of these measures are highly effective and cost effective, especially taxation. Not only does it help to reduce tobacco use in populations, but it also provides a revenue for governments, which can then be reinvested into national health services.
Thank you. This is really interesting. Dr. Hebe Gouda, if we know that raising taxes is the most effective way, can you tell us how many countries currently have taxes at the recommended level?
Unfortunately, only 10%.
And if it's such a win-win, why aren't we seeing more progress?
Well, we're battling a very powerful, a very organized industry. And it's not only well-resourced, it's also very resourceful. They apply a number of strategies to block public health measures. They intimidate through litigation. They have taken countries to court to block tobacco control implementation, in fact.
Okay. While the tobacco lobby may be strong, Dr. Ongongo, what recommendations would you make to governments to effectively protect people's health from the effects of secondhand smoke?
The only way we could also make sure that this is avoided, secondhand smoke, is countries to enforce the law of smoke-free in public places, to enforce it in the sense that it's implemented. As much as these laws are there, enforcement is the main issue.
So we've seen that enforcement is a key issue, particularly for vulnerable populations like women and children when it comes to secondhand smoke. Steve Hamill, in light of these challenges and in your work with Vital Strategies, what role have you seen women play in advocating for change to local laws and policies?
Thanks. Well, I'm happy to report that we're seeing women step into critical leadership roles, both globally and in a number of countries. And we've been privileged to support a number of women leaders in this area. And this includes both public health professionals, advocates, and victims. India is a great example. We saw a victim of tobacco use named Sunita, a young woman who was tragically diagnosed with mouth and neck cancer from chewing tobacco, use her voice to create a clarion call for change. And she became the focus of a national marketing campaign warning tobacco users to quit this product and others not to start, that eventually ended up in hundreds of thousands of people's, if not million of people quitting smoking and quitting tobacco use. And this is important not just because of the burden, but because women are the next big target market for the tobacco industry. We need women in leadership roles. We need to support women stepping into leadership roles if we're to win the battle against big tobacco.
Well, we can see that it's going to take an impressive effort to meet these challenges, but we feel that it's an achievable goal. I'd like to thank you for watching today and thank our panelists for the benefit of their perspectives and experience. Please go to our website where you can download World No Tobacco Day materials, follow us on Facebook, Twitter, Instagram, and don't forget to use the hashtag #NoTobacco. Thanks. We'll see you soon.